Guys, as always, promise made, promise kept. Mayor Spano is here with us. I called him, I tried to reach him last night, and he's always ready to speak with us. And today we made a point, Mayor, to talk to you because this virus thing, I don't want to use the word panic, but people are concerned.
People are very concerned. But remember one thing, and I think that this is important, and that's why I'm so glad that you're doing this today, that the reaction to the virus is much more concerning to me as a mayor than the virus itself. The virus itself, as we all know, is a little more than a flu. Most people, if they get the virus, many people won't even know they have it. A lot will be asymptomatic, in other words, won't even have any symptoms. But we have to react to it, right? And so what's happening right now is government is reacting to this virus, and it's the reaction and the response, I think, that has a lot of people uneasy, a lot of people afraid, because they're wondering what's underlining, like what more is happening that if I'm the average citizen, what's more that's happening out there that I don't know about? And there really isn't anything more. What I see, and in many different calls that I've been on with the governor's office and with the Department of Health, what I see is that the government is trying to slow the progression of this virus. They can't really stop it. They can slow it down. If you slow it down till you get to the summer months, the virus might disappear. If you slow it down till you get to the winter months, the virus might disappear.
Or may not.
Or may not.
Is that a chance we want to take?
But what the government is doing is slowing it down because you don't want to. Where it has its most devastating effect is on the most vulnerable population, our seniors, those who have compromised immune systems, especially those who have compromised lung functions. And so that's where you're seeing, you're seeing the government going the extra step to do everything they can to slow the virus down. Now, obviously, we have responsibilities as well to help in that effort. And so what do? So, you wash your hands. You try to avoid big crowds. If you sneeze, you make sure you try to sneeze, in your arm or into a napkin. These are things that you need to do, but especially washing your hands as many times, as much as you possibly can. And we'll get through this. I mean, this is not going to be mass carnage all over the place. It just isn't. And people, like I said, are reacting to this, and they're afraid, and I get it.
It's reason to be afraid.
Well, I think within reason, because you don't want to have the reaction, like I said, to the sickness be worse than the sickness itself, because you have the reaction is, well, what's happening? People pulling their money out of the stock market, and so you're seeing an influx in the stock market. It's down another 1,700 points today. It was up 1,000 points yesterday. It's going to be volatile, and these type of things all have an effect on the way we operate as a society.
Yeah, but Mayor, if we look at the federal government, and it seems like we underestimated this. We were not prepared to deal with this. We don't have enough tests. There is a problem in getting tested. There is a whole bunch of issues that making the people feel uneasy. Okay, in your city, you always say that Yonkers is the fourth largest city in New York. All the surrounding cities, they have confirmed cases. We haven't heard a confirmed case in the city of Yonkers until yesterday, the gentleman from the casino. Mm-hmm. And now we also know there is not law enforcement, parking enforcement, if I'm not mistaken, that is quarantined because he was in contact with.
Right.
With the
there are, from what I understand, and we have not been made aware of specific cases, but from what I understand, there are a number of confirmed cases
in Yonkers.
In Yonkers. And we heard that today because the Department of Health is finally starting to release some of their information. Now, I have a problem with that with the Department of Health and how and they're being so secretive, because I think that will only add to the mass hysteria. So we don't want that to happen. We need to be open, we need to be transparent, and people need to know that if someone has it, that we, like, again, there are more people with the flu in Yonkers today than there are with with COVID-19. So we have to be forward. We have to be forward thinking. We have to be transparent. But at the same time, we have to let people know that there are things that they can do to prevent this. But we shouldn't be in a panic over it. We really shouldn't be. Like I said, there are, we are experiencing. We're at the epicenter, right? Really, of what's happening in America today with this particular virus, because it all started, in New Rochelle. But there have so far been no confirmed cases in our schools as of today. And so, will there be a confirmed case? You know what? Probably. And we will deal with that. And will we close our schools? We will probably close a limited number of schools for a limited number of time. We'll do our cleanings. We've already cleaned our schools and disinfected our schools already, even without a confirmed case. We will continue to clean our municipal buildings and disinfect them, even though there has not been a confirmed case here. Now, I know that you heard about the gentleman who lived in New Jersey but worked as a horseman in Yonkers Raceway, or horse trainer in Yonkers Raceway, who passed away. And that's obviously very unfortunate. But the Raceway wasn't closed down entirely. The Department of Health only closed down the stables. So they see it as something that's confined, just
to that area.
Yes, and so and now we know that there were a number of employees who may have been in contact with that person. It's right now. In trying to find out if that's true or not, I've been getting conflicting stories as to whether or not it was a very close proximity or not. Mm-hmm. And so, what I've said to even people in my own staff here, let's deal with what we know, because I'm seeing that there's a lot of misinformation out there. Well, I'm getting people say to me, well, that one particular person, right, who's not been confirmed to have that virus, I have been told by 3 or 4 different people that was confirmed he has it, right? Well, but that's not true. But that happens across the board.
Yeah, but this is what people on the street are saying, that Mayor Spano is protecting us from the truth. They feel like there is something big coming up sooner or later, and they think that
No.
Okay? But the administration is keeping it quiet, not to cause the panic that you're talking about.
No,
any truth to it?
No, none at all. I have been very transparent. I will always be transparent. I think that, like I said, I've been critical of the Department of Health, which has not told us of the people who've been infected up until today. And that I have a problem with, and I've already expressed that to the powers to be. But as far as I'm concerned, as the mayor of this city, I'm going to be very honest, very forward, and make sure people understand and know, because that's the only way we can tackle this. But also, in tackling it is knowing that it's not the end of the world coming here, guys, and we need to know that, and we need to, because we have to operate our society. People have to be able to, walk the streets, go to school, go to restaurants, and do the things that they should be doing.
But it is the end of the world for many grandparents that might be, touched by this virus.
The most vulnerable population, you're right, are the seniors. And you know what? So far, from what I can tell, is that we have one person who might fit that age group who's been affected. And so,
well, Mayor, our sources say that is 4 patients at St. Joseph's Hospital on the 4th floor.
No one has told me that.
No one has told you that?
No one has told me that.
So we couldn't confirm it at this time. HIPAA laws, we cannot go there and get patient information. But this is.
But they also may have the flu.
Well, if they have the flu, they're not going to close the doors and don't let nobody in that floor. If they're doing all that, it's because there is serious suspicion that it might be.
They may have suspicion, right? And that's another thing to remember too. They may have suspicion, but remember, there are a lot of people who have the flu in America today. 8,000 people have the flu in America today, right?
Correct.
Over 1,400 of them been hospitalized, and that is a very public number. You can get that at the internet. The reason I'm saying be careful, more than likely they had the flu. They could have COVID-19, right? But so that's why I want to be very careful about the information that we release. Make sure it's the correct information. Make sure it's right, because it will lead to people being uncomfortable. And we want to be truthful, and that's what I do as mayor. And my job is to serve and protect, but also for the safety and well-being of the residents of our city, our police department, our fire department, our services. And we've had a number of meetings to close different programs that we're running because we want to limit the exposure, right? We're trying to limit it. We can't eliminate it, but we can limit exposure to people.
Minimize
and minimize minimize the exposure by having less events. But it is concerning to me that people see it and it makes them afraid. And I don't want them to be any more afraid than they currently are. I want them to understand that the government's doing what they need to do. Things are moving along in a very good way in terms of your services. Police department, fire department, your first responders, everyone is operating and doing everything they should be doing, and they're doing so without incident. We don't have any issues where we have police officers not showing up to work because they're afraid of this virus. We have a very good, solid response by all the city's employees, and people should be proud of that and know that we're doing the things that we should be doing and ought to be doing. And at the same time, people need to know that they should not be alarmed. There have been much worse viruses out there that have come across our community over the years than this particular
Mayor,
one.
but this virus, it's different than the other. This flu strain is different than one prior. Mortality rate, it's 10 times more than the regular strain of the flu. So it's much higher. So
I'm not, just so you know, and I'm not trying to, because I don't want you to think I'm being argumentative.
No, we're just talking.
I've not seen any figure that tells me the mortality rate is 10 times.
Well, they just reported this today by they just reported 10 times. But Mayor, one of the things, just the reason for this interview is so we can assure to the people of Yonkers that your administration is doing all that she can to make sure that this is contained, that people who need help get the help, and there is no risk, because you look around and you see all these schools, universities being closed, and in Yonkers, none. People are start to think. So we need to assure the community that things are under control.
And that's right. And that's a very good point. No confirmed cases for anyone in our schools. That's why our schools have not been closed. However, our schools have been scrubbed, and our schools will continue to be scrubbed on a regular basis, proactively scrubbed. We expect that there'll be a case. I mean, there's going to be probably more than one case, right? We all know that. So we'll respond accordingly, whether it be our senior centers, our schools, individual communities. We will respond the way we're supposed to. The police, fire department, and EMS, all operating 100%. Every one of them has gone over protocols to deal with this virus. So they'll continue to do what they should be doing. The community we will respond accordingly if there is an outbreak and that we have to deal with, and we will. Yonkers Raceway, as you know, was closed down not the raceway, but just the
Stables, right?
Stables were closed down, and if it went any further, the casino would have been closed down. So there is all the necessary responses that people need. Sarah Lawrence is, I'm sure, considering closing down because most universities are closing down, but that's not our call. The St. Patrick's Day parade has been canceled. It's not our call, but they canceled it. We have closed a number of programs that are being provided right now to taxpayers in our centers because we're going to do that, and we announced that today. The nutrition centers will continue to stay open because we don't want our seniors to starve, right? We will we'll do what we have to do there and do so in a safe manner. If there are school programs, after school programs that involve some of the boys and girls clubs that are external of the school district, they've all been canceled. And so we're doing everything we can that's reasonably expected to do our part to prevent the spread of the virus.
In regards to gathering, clubs, large number of people in one place, are you thinking about putting a stop to that for now?
The city has, we have already stopped any large gathering that we sponsor.
Okay.
Now, whether or not we can stop, a local church from having their own gathering, that's something we're looking at. But at this point, the administration has stopped any city-sponsored gatherings. We're not doing it.
Well,
And we have suspended all that, and what we decided to do is suspend everything till the end of March. And then the last week of March, we'll relook at everything again, because you know what? Maybe in 2 weeks, we're in a different place. Maybe that place will be a good place, which I hope that it will be. But we'll look at everything again in 2 weeks. I feel, like I said, I've experienced a number of things as mayor, Hurricane Sandy and some other things, but this is probably the most unique that
it is definitely
anyone's ever had to deal with. But like I tell my brothers and sisters, and I tell my children, we're going to be okay, and that there were worse things that we've had to deal with as a society, and that but I impress upon the residents of Yonkers and our families that there are things you can do, and they start just with your own, making sure you wash your hands and limit that exposure. Wash your hands as much as you can. You don't need to go to large gatherings at this point, and listen to what the CDC has to say and what the Department of Health has to say. We will take our direction from the Department of Health when it comes to our schools, if and when someone has a confirmed case. But right now there is not one, and that is and that's a good thing.
Now, Mayor, have you taken the test yet?
Have I now? No, I've
Not
not
yet.
taken the test. No. Well, I've not been. It's. I think that there's a shortage of tests out
Yes,
there
yes.
right now, and while I'm not symptomatic, I think, and I haven't been in any high risk groups, I think it's better that those tests go to those who are showing symptoms.
And that's exactly why I asked, because we had a few comments of people that criticizing certain hospitals because they called, say, look, I'm coughing, can I take the test? To make it clear that the tests are not taken just because you're requesting it, it's because you show symptoms of
Right.
the infection.
Listen, when there are thousands of tests out there and there's enough
Then,
for
yes.
everyone, and you want to take it just to make sure, fine. But when you have people who are showing symptoms, and you need to test them first.
Exactly.
You have to prioritize everything, and that's what we should do.
So, Mayor-
but there is no issue out there. There's no one's covering anything up. That's the last thing that any one of us should want to do. It would make no sense to do that.
So if time comes that you need to shut down the schools or whatever,
We will
it
do
will
so.
be done.
We will do so.
It will be done.
You know.
So, Mayor, I know that you have other appointments, so I thank you for taking the time as always. And this time we don't handshake because we can't, so we gotta do the elbow.
it.
That's the way, guys. Elbow. No handshakes. Wash your hands. Make sure everything's good. Don't be going to gathering places, bars, clubs. For now, be safe. Your health is important. Your family needs. Don't take unnecessary risks. Correct?
That's it. You know what? Spend some time with your family, you know what? And just try to take care of each other, because at the end of the day, this too will pass, and we'll be on to something else. And so, just listen to what the government has to say on this, and everybody will be fine.
On that note, we conclude this interview. Thank you guys for watching, and always stay tuned for On Yonkers Voice, because if it's important to you, it's important to us, and we want to address it. Thank you very much for watching.